Dr. Colin Bartoe here with the Functional Neurology Chiropractic Center. And today, I'm going to tackle a question that I get pretty frequently. And that is, what is functional neurology? To understand functional neurology, first we need to understand the concept of neuroplasticity. So let's break this word down. Neuro refers to your nervous system or your brain, and plasticity or plastic refers to the ability to be formed or molded, right? In this case, specifically, we're talking about the brain's ability to modify or rewire or adapt to our experiences and our expression. So how does neuroplasticity show up in our day-to-day lives? It's a great question. There's two ways that we tend to see it most often. One is if we do something over and over. The activity of doing a task or perceiving something over and over makes those brain cells fire and fire and fire. And every time they fire, they get stronger, just like exercising muscles. So we're going to do something over and over. It's going to become stronger and more efficient. On the other side of that token, if we have something that we do not use, something that we don't use, we lose. Exactly. So it becomes less efficient and less strong because it's not needed as much. Some examples of this would be if we take a young child out and we teach them how to throw a ball, chances are they're going to be throwing the ball all over in different directions. It's not going to be very strong or accurate at first. But with repetition and training, this child will learn through this plastic change, right? We're using the system over and over. It's going to become stronger and more efficient. They're going to build those motor patterns to be able to throw that ball more accurately with more force. Now, again, on the other side of the token, if you're like me and you learned Spanish as a kid and it's just not sticking with you because you don't speak it all the time, well, you're watching the other side of that plastic change. If you don't use it, you lose it. Now that we know neuroplasticity is the concept of the brain's ability to rewire, to adapt, and we know that if we use a system, it will become more efficient, it's not such a big leap to say that if we intentionally activate part of your brain, it'll get stronger. It'll work on that process of becoming more and more efficient. Some examples of this could be a concussion patient. For instance, somebody who's been in a car accident and had a whiplash type activity of their head, or somebody who's been involved in a sporting accident like a football injury. These individuals may experience headaches, eye pain, fatigue, brain fog, depression, anxiety, even suicidal ideology. These are all things that their brain can perceive or control. Our job in functional neurology is to find the areas of the brain that are not able to do their job as well as they should. Whether they're firing too high, they're activated too much, or whether they're firing too low and they're not doing their job well enough. We need to determine what areas need a little bit of that love, a little bit of that activation, that training, those exercises to get stronger, to make it so that your perception of reality is real, is true, and make sure that the control you have over your body is correct. In functional neurology, we can use your ability to feel, taste, touch, smell. We can use thoughts, emotions. We can use anything that the brain has at its disposal to perceive or control in order to activate the brain the right way and rehabilitate those injured areas. And I know that this might sound kind of complicated, but let me make it super simple. At the end of the day, functional neurology seeks to check and see how the brain is functioning, whether it's too much or too little or just right. And then we prescribe different exercises. We prescribe different things that will activate the brain in the right way and exercise it in the right way to make it more efficient and more effective in what it's doing. When we do that, your symptoms should improve. Your function should improve. And the goal is to get you back to your life as quickly as we can and with as much care as we can. Thank you, and have a grateful day.